Alright, so our next topic for discussion is fungal skin infections. Our examples are tinea pedis, tinea corporis, versicolor, capitis, and onychomycosis. Alright, these are fungal skin infections. We're going to diagnose them visually. All fungal skin infections of the hair, skin, and nails are diagnosed visually. Alright, and how are we going to follow this up? We're going to confirm it with potassium hydroxide or KOH test of the skin. That's another word for potassium hydroxide. You can see either one of them on the test, okay? Now, our most accurate diagnostic test, culture of the skin, all right? So we're first going to diagnose them visually. We're going to confirm them with the KOH of the skin, also known as potassium hydroxide, and our most accurate is the culture of the skin, all right? Now, here's where our algorithm comes in play. We're going to with the treatment of fungal skin infections, all right? You got to remember two of them for this, okay? You got to remember onychomycosis or tinea capitis, because all other fungal infections that don't involve the hair or the nails are going to be completely different, okay? Not completely different, but there's going to be something distinguishing in between, okay? So onychomycosis or tinea capitis, how are we going to treat them? We're going to go oral turbinafide or itraconazole, okay? And duration, if it's the fingernails, we're going to go 6 weeks. And if it's the toenails, we're going to go for 12 weeks. What do we have to worry about when we're given turbinafide? Elevation of liver enzymes. So we got to check our LFTs if prescribing turbinafide, okay? Now, what are you going to give a patient if they have liver cirrhosis or if they have some kind of liver toxicity? What are you going to do? You can't give turbinafide, right? This is when you can go to griseofulvin. Now, some people say that griseofulvin is never used. I know World says griseofulvin is never used, but Kaplan says it is used. So, the only time I guess they can ask you this question is if you have an elevation of liver enzymes. You obviously can't use turbinafide, okay? But if there's a fingernail infection, you can use griseofulvin, but you have to give it for 6 to 12 months, okay? And the important point actually not written here is that griseofulvin can't be used in toenail infections. It can only be used in fingernail infections, okay? And if it's tinea capitis, we're going to give it for 6 to 8 weeks, all right? Now, all other fungal infections that don't involve the hair or the nails, we're going to give topical medications such as ketoconazole, clotrimazole, miconazole, turbinafide. And the thing that's important here, all of them have equal efficacy, okay? Once again, if we're using ketoconazole, what do we got to worry about? We got to worry about those LFTs, okay? Because ketoconazole, as we know, can cause hepatotoxicity and gynecomastia, okay? So always monitor those LFTs when giving ketoconazole. So quick review. Fungal skin infections, right? Pedis, corporis, versicolor, capitis, onychomycosis. How are we going to diagnose them? Visually. Bam. Done. Next, how are we going to confirm it? Potassium hydroxide, also known as KOH of the skin. Diagnose visually, confirm with KOH, most accurate, culture of the skin, okay? If it's one of these two, onychomycosis or tinea capitis, we're using turbinafide. If it's in the fingernails, 6 weeks, toenails, lower down, 12 weeks, okay? Got to check our LFTs, and if the LFTs are elevated, can't use turbinafide, right? So you got to monitor the LFTs. And we can use griseofulvin for fingernail infection, but not a toenail infection. But we're going to be giving these patients 6 to 12 months if it's fingernails. If it's tinea capitis, 6 to 8 weeks. All right. Everything else, remember all these drugs right here: ketoconazole, clotrimazole, miconazole, turbinafide, all have equal efficacy. And once again, if we're using ketoconazole, monitor those LFTs and watch out for that gynecomastia. All right. And that's our fungal skin infections.